This is Dr. Todd Cooperman, President and founder of ConsumerLab.com. I'm pleased to welcome you to this webinar about fiber supplements. Over the next 40 minutes, you'll learn from a practicing gastroenterologist about the importance of fiber to your health and the role fiber supplements can play. Just a few housekeeping items before we begin. First, if you're on a computer, please make sure that the mute symbol is showing in the small control panel on your screen. This will help prevent background noise from interfering with our presentation. If it is not muted, please check the mute button on the panel now. You don't need to mute your phone if you're on a phone. Second, if you have questions during the webinar, you can email them from the control screen if you're on a computer. As time permits, we will try to address those questions at the end of the webinar. I'd like to thank P&G Personal Health Care, the makers of Metamucil, for sponsoring this webinar and allowing us to provide this as a free service. Editorial control of the webinar is maintained solely by ConsumerLab.com. As many of you know, ConsumerLab.com has been testing and reporting on dietary supplements for over 12 years. We have extensive reviews of nearly every popular type of supplement, but due to complexities of carbohydrate chemistry and the many types of fiber supplements, we have not been able to test fiber supplements as of yet. Instead, we have posted articles on our online encyclopedia summarizing their medical benefits and information about a couple of the different major types of fiber supplements. Today's webinar, however, will give you a very practical understanding of fiber supplements from a doctor who uses them daily within her practice. And it's with great pleasure that I can introduce our guest speaker for the webinar today, Dr. Robin Chutnick. Dr. Chutnick is a gastroenterologist with an integrative practice incorporating nutrition, exercise, and stress reduction. She is the founder of the Digestive Center for Women in Washington, D.C., and an assistant professor in the Division of Gastroenterology at Georgetown University Hospital. And so I'd like to welcome Dr. Chutnick. Are you there?
I'm here. Thank you very much for that lovely introduction.
Yes, and it's great to have you. So please teach us all about fiber and fiber supplements, and please, as I'm controlling the slides, please just let me know as I should progress forward.
Perfect. If I could have the first slide, please, Dr. Cooperman.
Okay.
So what I'm going to talk about today is a brief definition of what fiber is, and also a little bit of the physiology of how it works in the body, particularly in my neck of the woods, namely the digestive tract. I'm going to talk about some conditions that are improved with fiber, not just digestive diseases, but other conditions also. Then I'll spend some time talking about the different types of fiber and the sources, the dietary sources. How fiber supplements compare will be a summary slide looking primarily at different forms of soluble fiber, both viscous and non-viscous, and by the end of this presentation you'll know the difference. And then I'll talk about how to use fiber supplements based on my experience as a practicing gastroenterologist over the last couple of decades. Finally, we'll talk about some concerns and cautions, some pros and cons, if you will, and then we'll take some questions. If I could have the first slide. So the definition of fiber is quite simple. It's a part of plants that cannot be digested. Another definition that people sometimes refer to is the fact that fiber is a complex carbohydrate. It's also known as bulk because it tends to bulk the stool, or roughage. And you've probably heard fruits and vegetables described as roughage. Next slide, please. Thank you. There are two features of fiber that are really of pretty significant importance for the digestive tract, and that's the solubility of fiber and the viscosity. So let's go through these two features. Soluble fiber tends to draw water into the bowel. It becomes a gelatinous sort of viscous gel, and it can help slow digestion. And some sources of soluble fiber would include oats and barley, as well as psyllium, which, as you know, is a common ingredient for many fiber supplements. Soluble fiber tends to be fermented in the colon, and that can sometimes be a drawback in that the fermentation can produce gas and so on. So that will figure in later when we talk about how to use different forms of fiber. Insoluble fiber, on the other hand, and the commonest form of that is wheat bran, is metabolically inert, meaning it's not fermented by bacteria in the colon. Neither is it digested. It absorbs water, and it helps with laxation, namely bowel movements. Now, soluble fiber helps with laxation also, so there's some overlap there. The viscosity of fiber refers to its property in terms of being able to bind bile acids, cholesterol, and fats, and this leads to its cholesterol-lowering properties. Next slide, please. Populations that consume more dietary fiber have less chronic disease, and I'm fond of telling patients in my practice that fiber heals whatever ails you. It's not quite that simple, but the truth is that many, many studies have shown that when you get into the high range of fiber, above 35 grams of fiber a day typically, you start to see a decrease in the diseases that kill most Americans, namely heart disease, stroke, cancer, and diabetes, to say nothing of magnificent bowel movements. But the American Dietetic Association did publish a position paper on dietary fiber a few years ago in 2008. And the recommended daily intake of fiber based on reducing the risk of heart attack in men and women is 38 grams for men and 25 grams for women. Unfortunately, fiber intake in the standard American diet, what we call the SAD diet, is only about 15 grams, and in many populations it's less than 10 grams. So we're really not achieving those goals as a society. Next slide, please. The conditions helped by fiber are many, so if we start outside of the GI tract, definitely coronary artery disease. There's no question that fiber helps to decrease the incidence and severity of heart disease, and it probably does this in two ways. It does this, we talked about in the earlier slide in terms of binding cholesterol and so on, so it has a cholesterol lowering effect. But fiber also displaces fat and other forms of animal protein from the diet. So what studies have found is that the more fiber that you're putting on your plate, the less room there is for the animal protein and fat. So it really manifests this improvement in two ways. It is helpful for high blood pressure. It's also helpful for glycemic control for diabetics, particularly type 2 diabetics. And it does that by slowing down the absorption of sugars and other starches. In terms of the GI tract, very helpful for constipation and subsequently for reducing and treating hemorrhoids. And I do a procedure called endoscopic banding of hemorrhoids, where we attach a specific rubber device to the end of a colonoscope. We suck the hemorrhoids into it, and we pull a little trigger that releases a band around the hemorrhoid, essentially strangles the hemorrhoid, cuts off its blood supply. It eventually shrivels up, and it leaves a little scar in its place. But I do much, much less of this banding procedure these days because of my use of fiber. So I find it's pretty rare that I can't get somebody's hemorrhoid shrunk down to an acceptable level by getting them on a robust dose of a fiber supplement, usually psyllium husk. Diverticulosis, you may be familiar with this condition. Diverticulosis refers to the presence of little potholes in the colon, and we think that these develop over time because of a diet, a Western diet that's relatively low in fiber and high in animal protein and animal fat. And whilst fiber cannot reverse diverticulosis, it can help with the symptoms and it can help prevent progression, and we'll talk a little bit more about this later in the presentation. Irritable bowel syndrome, both constipation predominant and diarrhea predominant. Irritable bowel syndrome can be helped by fiber. Inflammatory bowel disease, both Crohn's disease and ulcerative colitis, and again we'll talk later in the presentation in more detail about these conditions. It can be helpful for weight control because it has a sating effect where it makes you feel full, and so you have less room for high-calorie foods. We mentioned glycemic control. Many studies have shown that colon cancer, both the occurrence as well as recurrence, can be helped by a high-fiber diet. And again, reflux disease, gastroesophageal reflux disease, or heartburn, because fiber is a relatively low-fat food, and we know that foods with a high fat content slow down the emptying of the stomach and increase the opportunity for reflux. So substituting high-fat foods with high-fiber foods is very helpful for acid reflux. I'm sure I'm forgetting one or two conditions, but these are some major ones here. Next slide, please. In terms of coronary artery disease, it's a higher intake of soluble fiber that seems to have the most benefit in reducing risk. And what studies have found is that a 10 gram per day increase in dietary fiber is associated with a 14% decrease in the risk of all coronary events and a 27% decrease in the risk of death. And all of this for 10 grams a day, which is really not that much. So it has a really dramatic effect. Again, fiber binds bile acids, and the body must use cholesterol to produce new bile acids, so that's how it reduces cholesterol levels. I don't know how many people on the call saw the CNN special last summer called The Last Heart Attack. Former President Bill Clinton was interviewed extensively, as well as a cardiologist who has been espousing a vegan diet for some time, and I don't think it's necessary to go to that extreme necessarily to become a vegan, but certainly the benefits of a plant-based diet, a primarily plant-based diet with large amounts of legumes and fruits and vegetables, the evidence is really incontrovertible. It's very, very dramatic. And again, this study showing that only 10 grams a day can decrease your risk for death from heart disease by over a quarter, by 27%. Really dramatic. Next slide, please. So to continue on about coronary artery disease, the most protective and the most significant cholesterol-lowering effect is soluble fiber from cereals and grains in the diet, as well as soluble viscous fiber from supplements. Products with beta-glucan from oats or barley, as well as psyllium husk, can reduce the risk of heart disease. And in terms of beta-glucans from barley, what they found is that high molecular weight beta-glucans may be more effective than low molecular weight ones, since they're more viscous. You know, fiber can get very, very complicated with soluble viscous and insoluble non-viscous and beta-glucans and all these different terms, but I think the general take-home message is food from nature, fruits and vegetables, and whole grains, things like brown rice and quinoa and even sweet potato. When you start swapping out some of the foods and you get into those high numbers of 20s and 30s and 40 grams of fiber, you really start to see the difference. And I think that's more important than remembering, am I eating soluble fiber? Am I eating insoluble fiber? Is it viscous? Is it non-viscous? It's just really trying to increase the plants in your diet. Next slide, please. In terms of high blood pressure, again, fiber intake is linked to lower blood pressure, and the reductions in blood pressure seem to be the greatest in the people who really need them, namely those with elevated blood pressure and older people. Next slide, please. For constipation and hemorrhoids, conditions that I see every day in my practice, fiber, and again, especially soluble viscous fiber, softens the stool. It has a bulking and laxation effect. It increases the amount of stool. Remember, we talked about how the fiber draws fluid in to form this gel. So it results in larger and ideally less frequent bowel movements. It's very, very helpful for somebody who is constipated or suffering from diverticulosis, where they're having multiple bowel movements, but they're incomplete. And we call that sensation tenesmus, and it can be very, very annoying. And typically people will say they sit down to have a bowel movement, they go, it's a very small bowel movement. They can feel that there's still more in there, but it's not coming out. And then half an hour later, 45 minutes later, they sit down, they have to go again. And again, they expel a small amount of stool, sort of little rabbit-type droppings, little pellets. And then they have to go again. And this can continue all day long with people essentially going to the bathroom half a dozen times but still feeling constipated. And so these situations are really ideal for bulking agents like fiber because it increases the stool. And what it does is it takes those multiple small frequent bowel movements and sort of consolidates them into one or two larger movements. And so it cuts down on the annoying frequency. It increases the bulk, and it results in more complete evacuation. And I think we all know how satisfying it is when you have that sort of large, complete bowel movement and you've really emptied the colon and the rectum well. So that's where it can play a major role. So it is considered a gentle laxative, but you know, I sort of don't like the term laxative. By definition, a laxative is anything that helps with laxation, namely the passage of bowel movements, or defecation. However, in common use, when we think of a laxative, we think of things like senna and those sorts of things, and fiber is certainly not that. But again, by definition, it's helping you have a bowel movement, so it is a laxative. Not the sort of laxative like stimulant laxative that can be harmful to the colon. The larger stools that we see with fiber use are primarily due to water, which is held by the fiber, as well as fermentation of the fiber, which increases bacteria in the stool. And we know that stool consists of about 70 to 75% dead bacteria. So again, it's by increasing the water and the bacteria, as well as the fact that some of the fiber itself is indigestible and adds to the bulk of the stool. And of course, a softer stool tends to be much less painful for people with hemorrhoids and also much easier to pass. Next slide, please. I should have warned all the participants on the call in advance that I can talk about stool for hours and hours, but I will try and stay within my allotted time today. So back to diverticulosis, one of my favorite conditions. So diverticulae, small pockets in the colon, we think are caused by a diet that is not sufficiently high in fiber. So the typical Western diet that's higher in animal products and lower in fiber results in a smaller, harder stool that's more difficult to pass. And over time, the colon has to contract very forcefully to move stool through the colon with this more limited fiber diet. The diverticulosis, the little pockets or potholes tend to occur in the sigmoid colon, which is the very sort of curvaceous part of the colon right above the rectum where the stool is stored before it's passed down into the rectum. And we almost always see diverticulosis extensively in that area. It can be throughout the colon, but the sigmoid colon is most commonly involved due to its anatomical location above the rectum. So fiber won't reverse diverticulosis if you have it. You have it for the duration. And in fact, 60% of Americans over the age of 50 have or will develop diverticulosis. And again, we think this is primarily diet-related. But what fiber can do is it can prevent the formation of additional diverticulosis by providing bulk, resulting in less forceful contractions. It can also help treat the symptoms of diverticulosis. What it does is it helps to flush out those little pockets and results in more complete emptying of the small pockets there, and that leads to decompression of the colon and much more comfortable situation for people who have diverticulosis. Diverticulitis refers to inflamed or infected diverticula. Next slide, please. So I'm going to talk about another very, very common condition for gastroenterologists, and that is irritable bowel syndrome. And we think that irritable bowel syndrome, abbreviated IBS, affects about 20% of the population. There tends to be a female predominance, but it can also affect men. Several clinical studies show that soluble fiber in particular helps to regulate stool frequency and consistency in people with IBS. There are three main categories of IBS. There's diarrhea predominant, constipation predominant, and alternators, people who have a mixed picture. And pain can be a part of either one of those three types. We think that for some people who are alternators, who have some diarrhea, that sometimes the diarrhea is an overflow phenomena and that they're primarily constipated, but they get to the point where the stool has been sitting in the rectum for so long and been so fermented that it finally starts to come out in a loose form. And so paradoxically, for some of those people, even though they're having episodes of diarrhea, treating them more as constipated and using bulking agents can help to improve not just the constipated days, but also the diarrhea days too. So both types of IBS can benefit from bulk-forming fibers. The diarrhea patients, the fiber can sort of sop up the looser stool and consolidate it, and the constipated IBS patients, the fiber can help to soften and bulk the stool and make it easier to pass. And there are different types of bulk-forming fibers that we use, including psyllium, calcium polycarbophil, wheat bran, corn fiber. It is important to realize, though, that the results may be inconsistent. So the main abnormality for irritable bowel syndrome is something called visceral hypersensitivity. And what that means is that the person with irritable bowel syndrome feels distension of the hollow organs, the viscera, like the intestines, feels that distension at a much lower volume. The classic experiment has been inflating a balloon, sounds lovely, I know, in the rectum of somebody who has IBS versus somebody who doesn't. And the IBS patient will feel that inflated balloon at a much lower volume. The patient who doesn't have IBS, you can inflate the balloon completely and they won't even feel it. So it's this hypersensitivity to distension. And I find that when I'm doing colonoscopy in people with IBS, I have to be very, very attentive to how much air I'm putting in. When we do a colonoscopy, we inflate the colon with air so that we can see well. And we do that in everyone, but if I know the patient has IBS, I'm very careful to try and take out all that air, to suck it out of the colon when I'm finished looking at a segment, because I know the IBS patient will be very, very uncomfortable if I leave them full of air. So air can do it, fluid can do it, food can do it, gas, and fiber can do it. So if somebody has IBS and we know they have visceral hypersensitivity and they're having a lot of pain, if I tell them to go home and take 2 tablespoons of psyllium 3 times a day, they're going to be very, very unhappy. They're going to feel like the Michelin man or woman, and it can actually make their symptoms worse. So if you are going to use, fiber has, again, an important role in IBS, but you have to really, you have to customize the fiber for every patient, and there are some patients who just won't tolerate it. They just don't tolerate the bulking and the distension of the bowel. But what I find is that patients come to me and say, oh, that doesn't work well for me. If I start at a very low dose, sometimes half a teaspoon, and I go slowly and I give the patient a couple weeks to sort of habituate to the half a teaspoon, and then we'll increase it to half a teaspoon twice a day. So going very slowly and spreading the fiber out throughout the day so that they don't get a big sort of full feeling from the fiber plus all the water you have to consume with it. So there are definitely ways to finesse the fiber. If you have tried a fiber supplement before and you have IBS and you felt worse or it didn't help, it doesn't mean that it might not be of help to you in the future, but you might consider going very, very slowly with it, tiny little doses throughout the day, and gradually increasing it to see if you can derive some benefit from it. Next slide, please. So let's talk a bit about weight control. There is, again, evidence that suggests that fiber, both from whole foods, from grains and fruits and vegetables, as well as from supplements, can have weight loss benefits. And this actually makes perfect sense when you think about the sating effect of fiber and how full it makes you feel. And this is sort of the opposite of the IBS patient, where sometimes we have to go slowly. In this situation, I'm going to tell my patient who's trying to lose 5 or 10 pounds, have 2 heaping tablespoons of psyllium husk 3 times a day, because I want them to feel full so that they are less hungry for the vending machine in the office. And the main study that we've looked at showed that an additional 14 grams of daily fiber from food was associated with a 4-pound weight loss over 4 months without changing anything else. And I think if you add a supplement or 2 to that, you can really increase that number. High fiber foods tend to be less calorie dense compared to high fat foods. So what we're really looking for is foods that are nutrient dense but calorie poor, and high fiber foods are classic examples of that, as opposed to things like chocolate and meat that are nutrient poor but calorie dense. So the bulking and viscous properties of fiber, the same properties that help with laxation, also contribute to fullness that can curb your appetite. So if you are looking to lose 5 or 10 or 15 pounds and also to improve your bowel movements and perhaps lower your cholesterol, it's a good idea to keep a fiber supplement at home and maybe take one to work, and perhaps between breakfast and lunch, and or between lunch and dinner, to have a serving or 2. It also forces you to drink water because, of course, you need to have large amounts of water. I recommend that patients take their fiber supplement in a powder form with at least 12 ounces of water, and ideally with another water chaser after. So it's a great way to get you to increase your water consumption also. Next slide, please. Glycemic control and diabetes, this is a really expanding field, and particularly as larger and larger numbers of Americans become diabetic, and particularly type 2 diabetes. And we know that much of this is related to diet and nutrition. So how does fiber help with glycemic control? It slows down the absorption of sugar. So it's a classic example of why an apple is better than apple juice. Apple juice has nutrients in it, but it doesn't have the fiber. And apple juice is composed of very, very high amounts of sugar. And so it's absorbed very quickly, and it causes a spike in insulin levels. And we know that insulin, in addition to regulating blood sugar, is also the hormone responsible for much of what is stored as fat in the body. So when you get those spikes in insulin, it tends to result in calories that are on hand being stored as fat. Those calories are very difficult to mobilize later on. When you eat an apple, on the other hand, instead of getting this sharp increase in your blood sugar from the sugars that are rapidly absorbed, the fiber really slows down the absorption of the starch and the sugar, and you don't get that big spike in your blood sugar. And you also feel full. Nobody feels very full after drinking a glass of apple juice, but both can be quite full after eating a nice large apple. So slows down absorption of sugars. You stay full longer. It displaces fat and sugar calories. Can also reduce visceral, or what we call belly fat, which is a risk factor for diabetes as well as heart disease and stroke and cancer. It doesn't contribute to net carbs because the fiber, again, is indigestible. And again, it doesn't raise insulin levels. Next slide, please. In terms of cancer, we have many studies, both from North America as well as from Asia. There are several Japanese studies that show that a high fiber diet coupled with low animal product. Now, again, these are not vegans. These were people who were just increasing the plant-based fiber and cutting down the animal protein in their diet, that it was protective against not just the development of colon cancer, but also recurrence. And this is especially true for insoluble dietary fiber, fruits and vegetables. So this is a direct effect and also an indirect effect, we think, through colonic bacterial fermentation. Remember, fiber is a prebiotic. It basically provides a wonderful substrate for proliferation of good bacteria in the colon. So we think there is also an effect here through bacterial fermentation, the products of fermentation, as well as increasing the amounts of what we consider good bacteria, such as Acidophilus, Lactobacillus, Bifidobacterium, etc. Next slide, please. In terms of food sources of fiber, for soluble fiber, that again tends to be helpful for weight, diabetes, and cholesterol lowering. Examples would be the sort of interior parts of fruits, legumes such as peas and beans, oats, rye, chia, barley, broccoli, and carrots. For insoluble fiber, which again, good for laxation, not that soluble fiber isn't, but particularly good for laxation, very gut healthy. Examples would include whole grains, wheat and corn bran, nuts and seeds, flax and hemp, and the skin, the peels of fruits, particularly apples, blueberries, and grapes. But I would certainly recommend you eat the whole fruit. Next slide, please.
Okay, and I just want to point out, and this is Dr. Cooperman, that many of these things are a combination of both soluble and insoluble fiber. Is that right?
That's right, exactly. Thank you for making that point. So, for example, inulin has elements of both viscous and non-viscous fiber, and soluble and insoluble. And if you looked at many, many fruits and legumes, there would be elements of both soluble and insoluble fiber in them, which is why eating the whole fruit or vegetable is such a good idea, because both types of fiber are important.
Okay, thanks.
Next slide, please. Thanks. So here are some tips to increase fiber intake, and many of these you're probably familiar with, but I think it's worth emphasizing them. Choose whole grains over refined grains. So brown versus white rice. A cup of cooked white rice has about 0.6 grams of fiber per serving versus a cup of brown rice, which is about 3.5 grams. So there's a huge difference there. The same for whole wheat versus white bread. And think about other grains too, like quinoa and amaranth and barley, where there's more and more quinoa around, so it's much easier to find these days. Other substitutions would be a sweet potato for a white potato. And then think about having more plant-based meals, sustainable days, vegan days, maybe doing a black bean burger or beans and rice, substituting eggplant for cheese in the lasagna. So there are lots of ways to get the plants in without, again, sort of completely changing your diet. Choose high-fiber snacks like fruit, popcorn, maybe without the Parmesan cheese, whole grain crackers, nuts and seeds. If you're going to do nuts and you are conscious of your weight, you should really choose raw, unsalted nuts, which are much less caloric. And particularly if you have high blood pressure or have concerns about that, then doing unsalted nuts is very important. Have extra vegetables with meals rather than just having a salad. Have a salad and Brussels sprouts and broccoli. So think about making 2 vegetables. It's usually not that much work to just throw some more vegetables into whatever you're steaming or sauteing or broiling. So think about doing 2 vegetables plus a salad, or 2 vegetables plus squash or sweet potato. And it's amazing how when you start to crowd the meat out a little bit, you increase your fiber consumption, but you can still enjoy the animal protein. Again, replacing white flour with whole wheat flour when you're baking, or even with almond meal, which is ground up almonds, is another great way to increase your fiber intake. Next slide, please.
And someone wrote in with a question on diverticulosis and nuts and avoiding nuts or seeds.
Yes.
What's your recommendation to them?
So, that there's a little bit of a sense for those of us in the gastroenterology community that information about avoiding nuts and seeds might be a little bit outdated. Certainly if you have had problems with infection or inflammation, if you are prone to diverticulitis, then I think it is important to avoid nuts and seeds. But the diverticular orifices in most people are large, and they're not so small that a nut, if it's well chewed, would get stuck in it. And remember, 60% of the population over 50 has this, and many of them are having nuts with gay abandon, not even realizing they have diverticulosis. So I would caution people who have had problems with symptomatic diverticulosis, whether it's been episodes of diverticulitis or pain or inflammation. But if you're asymptomatic and you're chewing the nuts well, I think you can get away with it. Thanks for that. Next question. Next slide, please. So here's some example of high fiber foods. And as you can see, dried fruits such as figs are very good, and pears are high up there. Even citrus, which we don't necessarily think of as a high fiber fruit, is quite good at 3.1 grams of fiber per serving. So I tend to recommend to patients that in addition to looking at the fiber content, you also want a variety. So if you eat fruit seasonally, you'll pretty much make your way through most of them. And in the fall, you might be doing more apples and pears. You might be doing more tropical fruit in the spring, and berries at different times, but certainly most fruits and vegetables, even dried fruit, which can be a little bit higher in sugar, tends to be very high in fiber. If you look at vegetables, split peas cooked, fantastic, 8.1 grams of fiber per serving. So batch cooking, where you make up a big pot of split pea soup, a big pot of cooked lentils, which are also high in fiber, is a fantastic way to get your fiber up. And if you have a bowl of lentils with brown rice and some kale for dinner, you will definitely notice it in the bathroom next day, and ideally in a very positive way. So these are some examples, and again, you notice that the legumes are very high in fiber. Next slide, please. On this next slide, I have some grains down there, some examples from cereal, raisin bran, wheat bran flakes, cooked oatmeal, and particularly steel-cut oats are very high in fiber with a lower glycemic index than instant oatmeal, meaning they cause much less insulin secretion. Brown rice is very high. I even put apple pie there. You see a piece of apple pie, all is not lost. You are getting a little fiber from that. Next slide, please. So now we're going to turn to fiber supplements. Next slide, please. So this slide is a bit busy, but it does provide a nice side-by-side comparison of various soluble fiber supplements. And as you can see, the first four are viscous, and that is beta-glucan, methylcellulose, commonly marketed as Citracel, polycarboxyl as Fibercon, psyllium as Metamucil, and then some non-viscous types, guargum, inulin, and wheat dextrin, which is most commonly marketed as Benefiber. And as you can see, for laxation, all of the viscous soluble fiber supplements have a laxation effect. And we also think that inulin has a significant laxation effect. And, you know, this isn't absolute, because certainly I have people who take Benefiber and do say that, yes, it helps with bowel movements, but this is more from what the clinical data shows. In terms of lowering cholesterol, beta-glucans, yes, we think some effect from methylcellulose and certainly from psyllium. In terms of decreasing the risk for heart disease, beta-glucans and psyllium, yes, from clinical trials. In terms of lowering blood pressure, it isn't a major effect from fiber, but a couple of them, again, the beta-glucans and psyllium tend to. And for weight control, I think that most of these, and again, we've limited this to where we have clinical data from actual studies to bear it out, but I would say that practically everything on here, if you're able to get in enough of a dose, a couple heaping tablespoons a day, and drink it with enough water, you can see some weight control effect based on the sort of early satiety of feeling full from the fiber. In terms of glycemic control, we think that beta-glucans, psyllium, and wheat dextran all have positive effects on blood sugar control. And, you know, some of these we don't have enough data, but we think that, again, it probably is the case that it is helpful. Next slide, please. So what are the potential negative effects of fiber? I mean, I've made this stuff sound like, you know, it can do everything, including walk your dog. What do we know dietary fiber can do? We know that it can reduce absorption of vitamins, minerals, and proteins. Now, reducing absorption of some things, like reducing absorption of sugar, is good, but we don't want vitamins, minerals, and proteins necessarily to be reduced. And you do have to be careful about taking it without a medication. Sometimes it can be binding. So you do have to sometimes separate it from other supplements and from medications. We know that it can also cause gas, bloating, and abdominal discomfort, and some of that is a bulking effect and some of that is a fermentation effect by bacteria. And again, one way to get around that is by spreading the dose out or playing around, experimenting with different forms of fiber that may be less bloating. I know that lots of my patients tell me that the psyllium husk causes a lot of bloating and other kinds tend to not. So worth experimenting with if you're having difficulty. They can cause diarrhea, and that's generally simply treated by cutting down the dose. They can cause constipation, conversely, if you're not taking them with enough water. What they don't do is cause laxative abuse, because again, these are not phenanthrene laxatives that are stimulant laxatives that the colon becomes dependent on. So there's no concern about your colon becoming dependent and not being able to have a bowel movement without them. Next slide, please. In terms of the dosage for fiber supplements, I generally recommend starting at a low dose and increasing slowly over time, because this really helps with tolerability. There's a wide range of doses. I have patients tell me that they terrifically on half a teaspoon of fiber, and other patients tell me that they're on 2 tablespoons 4 times a day. So there's a dramatic range of doses. And it really depends on the indication for use. If I'm using this for laxation primarily, I will go about it differently, as opposed to if I'm using it because somebody is a tiny bit constipated but really wants to lose 5 or 6 pounds and I'm trying to keep them full. Or if I'm using it for laxation, but I'm also using it to try and lower the patient's cholesterol, I will use it differently. So it depends, again, on why you're taking it. Next slide, please. So again, just to go over some of these concepts, slowly increase the dose. It will help reduce side effects. And generally, these are not sort of emergency conditions that we're treating, so we can take our time and go slowly so that the person is able to tolerate it. Drink plenty of fluids. The fiber needs water to work, otherwise it can be binding and you can feel like you've swallowed a brick. It will just sit there in the stomach and small intestine. So ideally mixing, if people are taking a tablespoon, I ideally ask them to mix it in at least 8 ounces and preferably 12 ounces of water, and to drink another large glass of water after. Also, when you're mixing most of the powder forms, when you get down to the bottom of the glass, it gets very silty. And I'll recommend that people, if they drink it down to mostly what's at the bottom, they just pour another glass of water into the same glass so that they make sure they get every last dreg of fiber. And when you're using it for laxation, probably finding the lowest threshold dose that works and sticking there is helpful, because if you go above that, you might run into issues with bloating and so on. Next slide, please. So other types of laxatives that are not considered fiber supplements, stool softeners such as Dosage, commonly marketed as Colase. Those substances pull water into the stool, so they help to soften the stool, and they help with constipation, but they're not fiber. Stimulant laxatives such as Senna, commonly marketed as X-Lax or Senecot, and Bisacodyl, Dulcolax, are very strong laxatives, and while they do have a role in treating constipation, I like to limit them to sort of a rescue emergency role, and I don't recommend them as a daily part of people's constipation armamentarium, because they can cause some problems with the colon if they are used chronically in large doses, where again the colon becomes a little bit resistant and difficult to have a bowel movement without large doses. Lubricant laxatives like mineral oil can also play a role in constipation, but they can cause vitamin depletion, so you do have to be careful with how you use them. Next slide, please.
And just to reiterate, in terms of if you're taking vitamin supplements, mineral supplements, and you're taking fiber supplement, what's your recommendation on when to take those?
I recommend separating them by at least an hour. And if you can separate them by I mean, I think an hour is generally sufficient, but if you can take them at a completely different time of day, all the better. And if you're taking your fiber in the morning, which I generally recommend so that you have gravity helping the fiber to make its way down into the colon, then to take the other supplements later in the day, in the afternoon or even at night.
Okay.
So I think
that was,
comes to the end.
Yeah, that was just excellent, and I'm sure the people listening in, enjoy the pleasure of hearing you speak. Having an expert in the room for such a period of time talking about fiber. Many questions have come in while we've been talking, and we have time for just going through a few of these. Actually, one people have been asking about glucomannan and konjac. That is a fiber. I believe it's a soluble and viscous fiber. Did you have anything to note on that?
Yeah, glucomannan is helpful for weight control, and it is very sating. It really helps to keep people full. And so lots of experts, I know Mark Hyman is very, very fond of it, and he's written a lot in his book Ultra Metabolism and so on, talks about glucomannan. And the main advantage there is satiety for people who are really struggling with weight, struggling with diabetes, trying to avoid high glycemic index foods. Using a glucomannan supplement can be very, very helpful there. It tends to not be as dramatic in terms of laxation, but very helpful in terms of keeping people full and helping with weight control.
Okay, and I know lots of water again with that necessary to keep it from kind of binding. Another question is, any reason to use fiber supplements if you're already getting enough fiber from foods?
You know, it's a great question, and as a gastroenterologist, I think there's really no such thing as too much fiber. I mean, there probably is, but I haven't seen it yet. Because when we look at countries like in the developing world primarily where people can't afford to eat anything much other than fiber and they're growing it themselves, when people are having 60 and 70 and 80 grams of fiber, which is very difficult to achieve on the Western diet, they have fantastic bowel movements and they have virtually no digestive diseases. We see very little in the way of diverticulosis and colon cancer and irritable bowel and reflux in those populations. And we think it's in large part due to the massive amounts of fiber that they're consuming. So you know, even my patients who are very, very good eaters and who are eating lots and lots of plants, I think it's still helpful. The other thing is that the fiber supplement, the fiber is already extracted from the food. So it's sort of a straight shot down to the colon if you do it with enough water. And so it's sort of a little less work for the digestive tract, if you will. So I think those of us even consuming a very sort of clean diet, high in fiber, it's helpful. And the other problem is that most people probably overestimate how much fiber they're eating. I've seen astonished faces when I frequently ask patients to do a 30-day food journal. And when they bring it in, I will typically randomly pick 5 different days and calculate the protein, fat, and fiber content of food. And it's surprising to people. People say, oh, I eat a ton of fiber. I have salad every day. But keep in mind that salad, a lot of the components of lettuce are chlorophyll and water, and lettuce is typically not a high-fiber food. And so they're having a salad every day, but they're not. If you're having a salad, you're putting in chickpeas and quinoa and Brussels sprouts and broccoli into your salad, great. But if it's just lettuce, and particularly if it's iceberg lettuce, you're really getting just a couple grams of fiber there. And people are sometimes really shocked to see that they're only making it to 13, 14 grams of fiber a day.
Another person wrote in, is it better to take a fiber supplement as a pill or in a drink?
In a drink by far. So the pills, you have to really take a lot of them to work. And patients frequently will say they see whole pills coming out undissolved in the stool at times. So sometimes the gelatinous coating of the pill isn't being completely broken down, or it's just shooting through too fast. But you really have to take a lot of them. So I really recommend the powder form. I just find that people get better results from that than the pills.
Good to know. Another person, actually several people have asked, which fiber supplements are gluten-free, and is psyllium gluten-free, someone asked.
So psyllium itself is gluten-free, but you have to look at the source of the fiber. So for example, if you take Metamucil, their basic psyllium husk is gluten-free, but their wafers are not. So it depends on the form. Sometimes the active ingredient, the fiber, is gluten-free, but there may be other ingredients in the supplement. So if you want to be 100% certain if you have celiac disease or you are gluten intolerant, it really should say on the label gluten-free, and that way you know that not just the psyllium or the inulin, but the entire contents are gluten-free.
Okay. And I actually did a little research. Looks like things like Citrusella is also gluten-free, polycarpapel is gluten-free. Benefiber, I guess wheat dextrin, contains a small amount of gluten, so it's kind of a borderline. If you're really sensitive, just be aware of that. And the last question we have time for, someone wrote in, is there any harm in taking fiber supplements if you have an autoimmune disease?
That's a fantastic question, because my area of expertise is actually Crohn's disease and ulcerative colitis, which are 2 fairly common autoimmune diseases in the GI tract that are part of inflammatory bowel disease, IBD, completely different from IBS. And fiber can both help and hinder those conditions. So depending on anatomically where the inflammation is located. For ulcerative colitis, it's limited to the colon, but for Crohn's disease, it can also involve the small intestine. And with Crohn's disease, we can see narrowing of parts of the intestine, and sometimes too much fiber can actually clog a narrowed segment of bowel. I had a patient recently who was hiking in the Sierra Nevadas and took a psyllium supplement with him, and he ended up with a bowel obstruction and almost had to have emergency surgery. So that was a situation where he just clogged himself, but he had a very, very narrowed, what we call a string sign, a very narrowed segment of the small intestine. On the other hand, I have had patients with both Crohn's and ulcerative colitis, primarily with colonic disease, where they find that it really is very helpful to their symptoms. It helps if they're having diarrhea. It helps to consolidate the stools. And again, the role as a prebiotic, we think that fiber also encourages the growth of healthy gut flora, which has an anti-inflammatory effect in those conditions. So both fiber supplements as well as dietary fiber can be helpful, but I would say if you have an autoimmune disease like Crohn's or ulcerative colitis, probably should do that with some medical supervision so that you're aware anatomically of where your disease is, whether they're narrowed areas that could get clogged and so on.
Right. Thank you. So we are out of time now, but once again, I'd like to thank our guest presenter, Dr. Robin Chutnick from the Digestive Center for Women in Washington, D.C. and Georgetown University Hospital. It's a great pleasure to hear you speak on this subject, and I'm sure those listening have enjoyed it. I'd also like to thank those of you who sent in questions both before and during the presentations, which were very helpful. Finally, I want to mention our appreciation to P&G Personal Healthcare, makers of Metamucil, for sponsoring this webinar and allowing us to provide it as a free service. As you know, membership to ConsumerLab typically requires an annual fee. This is a free webinar. And if you'd like to watch this webinar again or tell others about it, it will be available from a link on ConsumerLab.com later this week. We'll be sending an email to everyone who registered for the webinar when that becomes available, and we'll note that in our newsletter as well. So once again, Dr. Chutnick, thank you so much. It's a pleasure to have you on, and thank everyone for coming to today's webinar.
Thank you, Dr. Cooperman. Thanks for having me. Thanks, everyone.
Thanks. All right. Bye-bye. Thanks.